important time of year for our health. It is annual Medicare enrollment period. The choices you make now are so important to your health care coverage, but Medicare is complicated and often confusing. Here to help is Cesar Chacon. He is the agency owner and licensed broker with the Insurance Hub. I'll get it out. It's great to see you.
It's good to see both of you.
So I asked Linda to join us because Linda asks questions about Medicare all the time, and I thought the questions she has are the same questions you have. So we're going to try to break this down.
Let's do it.
Into only 5 minutes, which is why you're going to need to call you next.
Okay.
But so annual enrollment just started October 15th.
Correct.
What is the overwhelming thing that people need to understand right now?
You gotta start out with the ground rules. First of all, you can't pick a plan just because your neighbor has one, because we're all different.
Okay.
Right? So just because your neighbor says I have this plan doesn't mean that plan fits for you, because we all have different needs in terms of medications. We have different physicians. We have different hospitals we like to go to. So that's very important to be able to pick a plan based on your individual needs, not just because somebody else has that plan.
So I can sit down with you and I can say, okay, I need this, and you can tell me what I do need, because I don't even know some of the things I need covered because I haven't had to use it yet. So I need somebody to guide me. I'm very nervous because I need to change plans.
Don't be nervous. Caesar's here. So the Insurance Hub is here. And so basically what we would do is we would break down what it is that's important to you. What medications do you take? Who are your physicians? I think you have a Medicare supplement, so you really don't have to worry about too much on the health side, because you get any doctor, any hospital, anywhere in the United States that takes Medicare. You're okay there. Where you have to pay attention is what changed throughout the year with your medications. What plan do you have, and did they change anything in their formulary for drugs? So those are things that probably everybody that has Medicare should really take a look at. What changed in the year? Did they pick up a blood thinner, Eliquis, something that's more expensive in their formulary? Should they take a look at what needs to be changed, what plans are out there? There's about 27 different prescription drug plans out there.
Wow.
So,
oh my goodness.
So a list of the medications that you currently take is definitely something we would bring.
That is correct.
Okay.
Yeah, there are 44 different Medicare Advantage plans for those that don't have, looking at your own individual needs is probably the most crucial thing that you have to pay attention to when you're looking at a Medicare plan. You can't just go blind. It's like, I've had this for the last 2 years, I'm going to stay with that. You should really pay attention to what's going on.
Okay.
And you can get anything covered, it just costs a lot more, right?
Not everything's covered. Medicare doesn't really like to deal with brand names, so they always push you toward generic products, which isn't a bad thing, but some folks can't tolerate generic products. But there are foundations and other institutions who are really good at finding solutions if you're paying for something, a high-priced medication, and you need help. We have a lot of resources, a lot of foundations we work with that can actually help you in that situation. So we're really good at that.
And the people in Venice are going to have a lot of questions. They've been through so much with this hurricane.
Yeah, it hasn't been formally announced yet, but this Hurricane Ian that just came by will have a special enrollment period. I'm going to say this. If you have an opportunity to meet the deadline of December 7th for the end of open enrollment, great. Don't wait. But if you've been impacted by the storm and you with the power, you're without a house, or travel, a lot of things, internet, then you're going to have a special enrollment period through next year to make those changes to your Medicare
But
plan.
still, doing it now is certainly
very
important.
crucial, very important, yeah.
And getting help.
Yeah, that's correct.
What do you think is the #1 mistake people make?
Well, assuming that your plan is going to be the same from last year to this year. Assuming that your medication you just picked up at your doctor's office is going to be in your formulary. And it's very crucial that I keep talking about prescription drugs. It's the one thing I talk about all year long, right? Yeah. But it's very crucial to your plan for, because you're committed to that plan in 2023. And it's important that you forget about the background noise, the commercials you see.
Yeah, that's so confusing.
Yeah, like with the celebrities, don't fall for those tactics, because I can guarantee you they're not even applying for those products that they have there. Right. So I would just say be careful, the dynamites of the world, and so yeah.
The help is there. So when we make an appointment to come see you, we need to bring a list of the prescription drugs. What else do we need to prepare to bring with?
Well, basically, I can come see you. We can come see you as an organization. We can meet at a coffee shop. We can meet at your home. We can meet at our office. We have 2 locations. We have one in Bradenton. We have one in Sarasota. We always want to make sure that you know, we make it easier for you all, and so medications is important to pick the right plan. Your physicians, hospitals. There's a big one in Venice where Venice Regional just closed down, and that impacts a lot of folks in that community as far as what coverage they have. So there's a lot of different things that folks should be looking at when it comes to choosing a Medicare plan.
We need individual attention.
Yes.
Absolutely, and that is why I think this is so important to get out there. Now is the time. The deadline as of now is December 7th, and you can make an appointment and get that individualized attention to have your questions answered. I know you're going to have to race Linda because she is ready to get some help. All right, you can find Cesar and his staff at theinsuranchub.net. We'll be right back.